pass a Prescription Drug Affordability Board. So AARP Illinois continues to be on the front lines. We are fighting to bring down the sky-high cost of prescription drugs for older Illinoisans. The recent introduction of legislation to create the Prescription Drug Affordability Board, also known as PDAB, so you're going to hear us say PDAB a lot today, but it marks a significant stride towards reducing the cost of prescription medications for older residents of Illinois. So today we are joined by our legislative champions and bill sponsors of the Prescription Drug Affordability Board, or PDAB. That's Assistant Majority Leader, State Senator David Kaler from the 46th District, and Representative Nabila Syed from the 51st District. Now, before we hear some opening comments and statements from them, if you would like to ask any questions during our call, any questions, comments, please press *3 on your telephone keypad. You'll be connected with an AARP staff person who will note your question and place you in the queue. Now, we're also streaming live on Facebook and YouTube, so for our Facebook and YouTube listeners, please put any questions you have in the chat, and we'll be sure to get those answered as well. Now, I'd like to take this really wonderful opportunity and extend a very warm welcome to Assistant Majority Leader Senator David Kaler. He serves the constituents of the 46th District, which encompasses parts of McLean, Peoria, and Woodford counties. As Vice Chair of the Senate Energy and Public Utilities Committee, Senator Kaler has been a dedicated member of the Illinois Senate since 2006. I'm so honored to be with him and have us join us today. Welcome, Assistant Majority Leader Kaler. Appreciate you for being here, and please share any opening comments that you have.
Yeah, well, thank you so much, and thank you for AARP for always doing such a great job in making sure that people are well informed and up to date on what's happening in the legislature. So, I can't say enough about AARP. You've always represented the interest of older citizens of the state, and you do it very well. So this is just another example of that. But I'm so honored to join Representative Syed in being able to sponsor this bill. Last year, as you mentioned, we sponsored the bill to have the Attorney General intervene in cases where there's drug price gouging going on. We were successful. That is now law. And again, it's just a pleasure to work with you, Representative, because you are such a breath of fresh air, and you represent the youth and the vigor that we need. I'm at the other end of my career, but to see somebody like you who has fresh ideas and energy, it's just a pleasure to always to work with you. So wanted to say that. Prescription drugs have been a problem for people and families to be able to afford, and we hear horror stories of how people are having to split pills to increase the time that they have to take their medicine because they can't afford to refill their prescription when they need to. This is just unacceptable in a country where we really have the bulk of the manufacturing of pharmaceuticals take place in here. I have to scratch my head and think, why is it that people can buy prescription drugs in Canada cheaper than they can in the United States? It doesn't make sense. And one of the things you have to understand is that there's a lot of people that from the time that it leaves the manufacturer's warehouse to the time it's in front of you at the pharmacy counter, there's a lot of people that have their hands in that process that take large, vast amounts of money out of the system. And so what ends up happening is that you end up paying an exorbitant price at the counter for your drugs. I also want to put a word in here for the independent small pharmacies, because they don't have a whole lot of control in this either. And I've sponsored legislation in the past that have helped to protect the interests of small pharmacies, because once they're gone, then the only folks we have to deal with are the large corporate entities that sometimes, in fact, own their own PBMs, and they make money every time the drug goes from the manufacturer into all the different steps that it goes to, and finally is at your counter. So let me just put a word in for the small pharmacies as well. But this is an issue that has to be resolved. We as a population that's getting older, and I'm in that category, I'm a senior citizen. I see my friends, my family, my neighbors all struggling with the same issue. We have to do something that begins to bring down this so that we have a quality of life and so that we can really afford to live out our years in dignity. So that's my initial statement. I'd be happy to engage in the conversation as we get questions in. But again, thank you to AARP and thank you to Representative Syed.
Thank you so much, Leader Kaler. Appreciate you. Wonderful points for sure. And boy, you really set me up really well to to introduce Representative Syed. So I'm very, very happy to welcome State Representative Nabila Syed. She is a breath of fresh air. She's wonderful. So the representative is a resident of Palatine and has her district incorporating in that area. She represents the voters of the 51st House District. She is an esteemed member of the House Appropriations Health and Human Services Committee, and she's the House Prescription Drug Affordability Committee a person as well. So, I mean, this is a perfect person to have on this and to be leading in issues on prescription drugs. So welcome, Representative Syed. Thank you so much for being with us, and please share any opening comments.
Thank you. Hi, everyone. Thank you so much for having me. Thank you to AARP for putting this together, and to Senator Kaler for, teaming up again to take on this huge issue. My name is Nabila Syed. I am a state representative in the 51st District, so I represent portions of Palatine, Hoffman Estates, Hawthorne Woods, Deer Park, and a lot more other municipalities. This is a suburban district, so half of my district falls in Cook County, and then the other half falls into Lake County. Like the Senator alluded to, I am very new. I was inaugurated last January in 2023, so I'm a freshman legislator. I also happen to be one of the youngest legislators in the Illinois General Assembly. And in my short time in the legislature, I focused a lot on healthcare so far. So paid leave for organ donors, prohibiting price gouging of generic drugs, which we were very, very lucky to work with Senator Kaler on. And right now we're working on a bill to expand MBI testing for breast cancer. And also the big topic of conversation right now, we're working to get this Prescription Drug Affordability Board passed here in Illinois. And just building off of what Senator Kaler mentioned, it's so important that we're working on this issue. Nearly 3 in 10 Americans have skipped prescription medicine because of the cost. Meanwhile, at the same time, the biggest pharma companies have more than tripled in profits over the last 2 years alone. It's a very complicated process, from getting a drug from the manufacturer all the way down to the person buying the prescription at the counter. But it's also a process that really needs to be reviewed and assessed to make sure that consumers at the end aren't being taken advantage of. So there's a lot of work here to do. I'm excited for the work that we're doing right now on a Prescription Drug Affordability Board. And yeah, that's about it. So once again, thank you so much. I'm so happy to be here. Thank you for having me.
Oh, thank you so very much. Appreciate your comments as well. So for our folks on the line here, please press *3 on your telephone keypad if you'd like to be connected with an AARP staff person so you can ask a question live to our wonderful guests. So if you'd like to ask a question, make a comment, please press *3 on your telephone keypad. And again, we are streaming live on Facebook and YouTube. So again, for our listeners there, please put any questions you have in the chat. I know we have questions that are coming in. So as those are continuing, we will kind of get started with some questions. So I'll throw out a couple so we know exactly what we're talking about here, although you guys set it up perfectly already. But particularly with the legislation we really want to talk about today, the Prescription Drug Affordability Board, or PDAB, maybe you guys can talk a little bit about what that actually is. What does it mean to have a Prescription Drug Affordability Board? What is this legislation? And how really will it directly help make prescription drugs more affordable and accessible for Illinois older adults? I don't know who wants to go first, but perhaps both of you want to add into this.
Well, I'll start. This is Dave Kaler. You need to look at both the examples of Colorado and Oregon to see how the Prescription Drug Affordability Board works. Those are 2 states that have set up the legislation, Colorado being a little more advanced in terms of their efforts. But it's a group of experts that are appointed to this board that look at what the costs are of the manufactured drugs, they are then, given the task of really setting the upper payment limit so that it takes any of the excesses out of the cost of the drug and passes those on, hopefully, to the consumer. So that's really the end game. And I want to go back to that point because what Representative Syed explained in her open comments is exactly the point. What we have to make sure that we do is see that at the counter, when folks like you and me are there getting our prescription drugs, that drug is affordable, that we're not paying exorbitant profits to all the people up and down the line that are taking and squeezing money out of this system. Let's make sure that we can deliver on having affordable medications for people to extend their lives. That's what this is about. So, Representative Syed, I'll let you answer it as well.
Yeah, just a few things to add on and to emphasize on what you said. It's an independent body, so they have the ability to evaluate high-cost prescription drugs and set these reasonable rates for Illinoisans to pay. So they'll take a look at the wholesale acquisition costs for the drug and take into account a number of factors to determine affordability, like the cost of the product, the patient cost sharing for the product, stakeholder input, public input, to determine whether or not a drug is truly accessible and affordable. And then, just determining based off this comprehensive review process, whether or not an upper payment limit should be set. And ideally, that upper payment limit will help reduce costs down the entire supply chain to make sure that cost savings are being shared with the patient, that the drug is less than it is once the UPL is set than it was before. And I think the biggest thing to note is even the conversations that we've been having with pharma and the conversations that we've been having with a number of stakeholders involved in this legislation, there are clear issues in the way that pharma is unchecked in our country at the federal level, at the state level, and I think this provides a very useful and much needed tool to evaluate how pharma operates, how manufacturers operate, how wholesalers operate, and provided much needed review to that process to make sure that consumers aren't the ones hurt at the end of the day.
Oh, I love how you just described that. It's a tool to. I think that's a great way to explain that. Thank you so very much, both of you, for your comments. So can I ask an additional question before we go to the live questions, because we have so many coming in. Again, anybody who wants to ask a question, press *3 on your telephone keypad. You'll get connected to an AARP staff member who will note your question and place it in the queue. Okay, so before we go to that, so can you elaborate a little bit on the criteria for selecting medications that would be under the Prescription Drug Affordability Board review? Like, do you think that there would be opportunity for public input? Would you be looking, would the board perhaps be looking at, only the top, X amount of drugs that are that are the most expensive, that kind of stuff? Like, how will that criteria kind of be set on what drugs would maybe be even concentrated on first?
Yeah, so I could start off with this one, if that works, Senator Kaler. So the Prescription Drug Affordability Board would specifically look at a certain subset of drugs, and there's different criteria for the kind of different drugs. So brand names, for example, if there's a wholesale acquisition cost of over $60,000 per year, or for the course of the treatment in that year, then that is a drug that will be reviewed. Or if there's an increase in the wholesale acquisition cost of $3,000 or more in any 12-month period, there's a similar criteria for biosimilar drugs, for generic drugs. But essentially, any drugs that may create an affordability challenge for the state healthcare system or patients, and also it includes drugs that might be used to address public health emergencies. So there's a wide range of drugs that can be reviewed within under a Prescription Drug Affordability Board. And yes, I guess addressing the second question you asked, the board will definitely ask for public input. And the board provides opportunities for public comment at the open meetings that the board will have. And they also provide the public with opportunity to have written comments when they're making decisions regarding a specific drug.
Great, that's so helpful.
Yeah, that was very well answered. Yeah, I'll just add that you can probably guess that the drugs that have high prices are the ones that you see on TV every night. If you watch any TV at all, you'll see that probably a good third of the ads on TV are these long ads for drugs and I always have to ask my wife, who's a nurse. I say, what is that one for? What does it do? It shows all these people in their happy place, being active and lively, and then they give the disclaimers, of course, which are all the side effects and things. But those are the drugs that probably, because of the amount of money that they're spending on advertising, those are probably the drugs that we want to look at first. And yes, I'm glad the representative mentioned that there will be public input into this process.
Great. Thank you so very much, both of you. Okay, so we actually have quite a few callers who have questions, so we're going to go live to our questions. Okay, so we first have Sarah. Sarah from Mount Morris. Are you on the line? Hi, how are you today?
I'm just real good. I have a question about the inhalers, and I know they're advertised on TV. I'm just so glad that you're doing this, like Advair, Buterol, and I understand that the cost has gone up. What I read on the internet was something about the propellant was changed, and so therefore how it was made was changed, and then because they can't go generic for a while. That was a drug I was interested in, the inhalers, how that might change.
Great. Thank you so much.
The one I have is, I just looked at it, I'm just new to it, it's like $147 a month.
Oh, yikes, yeah. That is pricey. Okay, all right. Thank you so much for your question. I'm not sure if either one of you want to take that one on about inhalers particularly.
It's hard to tell because, without having a board in place, I would say yes, that would definitely be a candidate for review. I think we need to look at what the experiences of Colorado and Oregon have been in terms of how they have selected some of the drugs that they've gone after. It's hard to tell right now because we don't have a board in place. We don't have an exact criteria as to how they're going to address this. But I would think that would certainly be on the list.
Yeah, and just to add on, I do believe that inhalers could be reviewed as an entire class of drugs. I believe Oregon did that with insulin drugs as well. And so I do believe that certainly inhalers could all be regulated. And I did want to add on, I think what you saw on TV was also another bill that Representative Laura Faber-Diaz is working on, having like health plans limiting the total amount that someone covered by insurance could pay for a prescription inhaler that is covered to not exceed like $25 for, I believe it was a 30-day supply. So in addition to this, I know there's another legislator that is specifically working on inhalers and working to make those a lot more affordable.
Great, thank you both for that wonderful information you've provided. Great, thank you. Okay, so let's go to our next caller. We have David, I believe, from Naperville. David, are you there?
Yeah, I just talked to you.
Well, actually, so you spoke to one of our AARP staff folks and asked your question. You were put in the queue, and now you're with the whole group. So if you would be able to ask your question again or share your comment again with, obviously, Leader Taylor and Representative Syed, then we can talk about it.
Sure.
Yeah, thank you.
I'm low income, and I need a drug called Linzess made by AbbVie. I've gone through with my doctor with some samples. They're working great. But when you try to apply for financial aid or basically getting the stuff at low cost or no cost, you get stonewalled. You send them tons of data, faxing them. They want it faxed. They have come back, told me that the fax is blurry, all sorts of delaying tactics. And both my doctor and myself are just disgusted with the way they're doing it. On the other hand, I've been having great luck with a company called GSK, which has inhalators that my wife needs for COPD. They've been automated for a couple of years, and it's just as smooth as silk. I think there's a big disconnect between when somebody that is low income, it tries to get through all of the phone calls, all of the transfers, and all of the denials. They're just getting stonewalled, and there's got to be a way to clean that up. I mean, your doctor should have the authority to apply for you. And on another subject, which is much broader than this, but I have been told by various pharmacists, this is on a slightly different subject, that the copay is being demanded up front by certain medical institutions, one in particular called Dooley here in the Naperville, Illinois area. Before you even see the doctor, they want the copay before they've submitted whatever it is the doctor does to your insurance carrier. Is there any truth to that in Illinois?
Well, David, I will have. Oh, sorry. Go ahead. Leader Kaler. Go ahead.
Yeah, I was going to say yes, that does happen, I've experienced that myself. In terms of, I know a lot of pharmaceutical companies do have programs for low-income people. I've talked to the representative and I about that. Well, they do help. So if you will give your information to AARP, the representative and I will follow up on that and make sure you get some answers. Because they have touted this as one of the ways that they are working to resolve this issue. But what you're describing is that, yeah, it sounds good on paper, but it doesn't actually work. So we will look into that and try to get you some answers on that.
Yeah,
great. Go ahead, Representative.
And I think what you highlighted, the difference between your experience with JSK versus the drug that you need, is something that will be taken into account in this review process. I think building off of what Senator Kaler said, that is something that these manufacturing companies talk about, patient accessibility. Patient accessibility, if it's not affordable, we'll create ways for it to be more affordable. But we see that that's not necessarily happening. And if that's happening, it might be putting the burden on consumers to go through this very long and arduous process of having to navigate a system that you're frankly maybe not that familiar with, and nor would you have any reason to be. So I do believe that that's another argument for why we need a prescription drug affordability board right now, is because there's very, very many ways in which there's claims that it is accessible, but it frankly isn't. And that difference in your experience with your wife's drug versus your drug highlights that. So I'm very sorry to hear that that's been your experience. Please, just to reiterate what Senator Kaler said, please pass along your information to AARP so we could get it and hopefully figure out a way that we can help you or direct you in some other way.
Yep. Thank you both. Appreciate you, and yes, for that individual caller, for David, yes, please reach out to us and we'll get connected and see what we can do for sure. Thank you. Okay, so again, just want to have a friendly reminder. If you have a comment or a question, please press *3 on your telephone keypad. You'll get connected with an AARP staff member who will note your question and place you in the queue. And we, of course, are streaming live on Facebook and YouTube, and so if you have any questions there, please put them in the chat. And so actually we do have a question from our Facebook listeners. And so the question is blood thinner Eliquis on your list? I am a newer patient of this drug. It is life-preserving and the best for patients without the frequent doctor office visits, frequent blood tests, and other food restrictions of Coumadin. Will this be included?
So just to start, the drugs that will be reviewed will be determined by the Prescription Drug Affordability Board. So, unlike what the federal government has done with the list, I believe it's actually on Medicare's list to be reviewed. So it would apply. So it would for sure get a UPL under our legislation, Eliquis specifically. For other drugs that may not be on Medicare's list already, we can't necessarily determine that off the bat because that would be the Prescription Drug Affordability Board's job to determine which drugs will be reviewed. But since Eliquis is on Medicare's list, it will be reviewed, or will have automatically a UPL set is the correct word.
Yeah, and UPL is the upper payment limit. Just want to clarify that. Okay, great. Leader Kaler, you're okay? Do you want to add something else?
She's answered that very well. So I have nothing to add.
Okay, perfect. Thank you. All right, so let's go to our next live caller. We have Les from Sauk Village. Les, are you there? We have a member from Sauk Village. I have Les. Les, are you there? Okay, maybe not. Let me ask this question, though, because it's a very good one. What is the bottom line on lowering the cost, really? What are you planning to do to bring down the price of drugs for those on fixed incomes but can get the lower prices of drugs? And this is after paying deductibles, et cetera. So outside of this PDAB, Prescription Drug Affordability Board, what are other program options as well until it is in place? I don't know who wants to take that one, but
yeah, that's a tough one to answer. Again, and you know, the representative Sayed and I have met with numerous representatives of pharmaceutical manufacturers, and they all tout that they have programs available for people on low income. So we need to make sure that works. As we heard in the previous caller, it didn't work so well. So we're going to try to find out why. But I want to go back to something that was talked about earlier, and that is what we did with insulin. In Illinois, we capped insulin at $35. Now, I don't remember hearing of any company going out of business because we did that. So I think that's a good kind of a model to build on, is that if there are specific drugs that, you know, and insulin is widely used. I mean, if you're diabetic, you have to have insulin. You know, it might be that we would look at something like that across the board. This would be for future legislation. For the PDAB board, they're going to have to set their targets in terms of what they think are the most appropriate drugs to go after in terms of looking at upper price limits. And they won't do all of them all at once. I think in Colorado they took a list of 5, and they're starting to work down on that. So you know, the process may be a little bit slower than what everybody wants, but at least it would be a good beginning for us.
Sure. Thank you so very much. Representative, did you want to add something else?
Yeah, just to say that there are several other bills in process that I know other legislators are working on to address these affordability challenges. It is a longer process to get some of these things going, just given the influence and the power that some of these other stakeholders have in when it comes to this. But we want to make sure that we're working towards providing more review and more oversight over these manufacturers that frankly go unchecked. So we're hopeful that even at the federal level with some of these Medicare drug negotiations, we're going to start seeing the benefits in Illinois and all across the country. But I think your question highlights just the need for this and the need for this right now.
Yep, absolutely agree with you guys. Okay, great. Thank you so very much. Again, friendly reminder, please press *3 on your telephone keypad if you have a comment or a question, and you will get connected to our wonderful guest today. So please press *3 on your telephone keypad. Okay, so we're going to go on to our next caller. I believe we have Ernie from Roselle. Ernie, are you there?
Yes, I am.
Awesome. Thank you so much for being on the call, and please ask your question.
Thank you. I have a medication which, well, actually it's Xarelto, that's also a blood thinner like Eliquis, and it had recently gone up through my pharmacy to over $500 for a 90-day supply. As a senior on a fixed income, I was forced to research and finally wound up ordering it from Canada. In the process, I found out that the reason that these drugs that are manufactured in Turkey and India and other countries are so much less than they are here is that they have regulation that we don't have. I've assumed that we don't have that because the Congress is in the pocket of the lobbyists from Big Pharma. Is that basically what's standing in the way of legislation to regulate here, or are there other major hurdles?
Interesting question, Ernie. Yeah, that part of why we have to do this on a statewide basis is because Congress has failed to do that job. And I remember years ago when we finally got Medicare Part D involved with Medicare, they weren't allowing the government to negotiate any discounts. Well, finally we're at a point where we can see that happen. But across the board, I must say that I've been a critic of what Congress has failed to do because healthcare just across the board is something that should have been resolved a long time ago. We have a healthcare system that is just a patchwork of different types and different coverages for people. I mean, thank goodness we finally got Obamacare. That's going to be President Obama's legacy. It's Obamacare that has now covered people that have been in that working poor middle class area and have struggled to be able to afford insurance. I mean, if you have a job through your employer that pays for your health insurance and it's a very what we call a Cadillac program, well then you're fine. But if you have 2 or 3 jobs where you're part-time here and part-time there and you don't have health care coverage, well then what do? That's where Obamacare has come in to help fill that gap. But we have a real mishmash of a healthcare system in this country, and again, I'm not sure what all the reasons are. You pointed out one that might be potential, but we need to have the federal government step up as well.
Representative Syed, did you want to add anything?
Just echoing the fact that yes, there is significant barriers to getting something passed, and ideally, I think we would all like to see that at the federal level, they acknowledge how our system is, like Senator Kaler said, just a patchwork of different entities that have their hands in, from PBMs to pharmacies to drug manufacturers to wholesalers, and it's frankly not a fair system. So I'm hoping that the Medicare drug negotiations that they're doing at the federal level, which is a huge step in the right direction, will help with that. I believe our prescription drug affordability bill also considers price increases because some drugs that were reviewed under Colorado's prescription drug affordability board, they're looking at them depending on their price increasing way beyond inflation. So these are all steps in the right direction, but I do, in an ideal world, I would like to see the federal government doing a lot more on this issue, and some of it's constrained by a number of factors, but we want to make sure we're getting it right. We want to make sure that we're being effective in the legislation that we're passing here in Illinois as well.
Great, thank you both so much.
Let me just add to that, because I think there's we need to recognize that we live in a capitalist society where profit is a goal of companies, and I would not ever say that drug companies shouldn't be profit motivated and shouldn't work their hardest to develop the best and the most healthy way for people to maintain their longevity. But the point is that when you have excesses, just because somebody can make a profit and you squeeze the people that you're really trying to help, then the system needs to be adjusted. And I think that's what we have going on. We're not saying that the drug companies don't have a right to make a profit and to do the best that they can, but we're also saying let's consider that the very people you're trying to help can't afford it. And that's where the problem lies. And so we have done nothing to really maintain the health of this nation if we put that financial burden there in between somebody who really needs the drug being able to get it. So I just wanted to state that as well.
Yeah, no, thank you so much. All valid points, and yes, completely understand and agree with what you're saying. Thank you both so much. Okay, so let's go to our. Well, actually, here I'll do my other friendly reminder. Right, so press *3 on your telephone keypad if you would like to ask a question or make a comment. Again, for our Facebook and YouTube listeners, please feel free to put your questions in the chat. Okay, so we're going to go to Mary in Lockport. Mary, are you there?
Yes, I am.
Thank you so much for being on the call, and please ask your question.
Okay, I was watching C-SPAN this morning, and they had a man from Maryland on who has something similar to PDAB going on in his state. And I was astounded at how Byzantine the way that the drugs are negotiated between each individual doctor, each individual hospital, and that controls the price. Now, they had an example of a woman from Europe on. She paid $16 for her prescription, but when she got over here on vacation, she had to pay $700 for the same thing. It's because in Europe, they only have one entity negotiating for everybody, not all these individual patchwork of people negotiating with these drug companies. Also, they said that all the raw materials for the drugs that we have are coming from China and India, even though they may be made here. I was wondering if sourcing the raw materials here would help to lower the prices of drugs.
Thank you, Mary. Thank you. Wow, $700. That's the one that just keeps sticking in my mind. Wow, what perfect timing that you saw this and shared. Thank you for sharing. Anyway, Leader Kaler or Representative Syed, did you have a response?
Yes, and part of the mystery of how drugs are priced has to be seen up and down the system. There's something in the business called a rebate. I would maintain that in any other industry it'd be called a kickback, but it's called a rebate. And so the price of drugs really are negotiated on that rebate. And so I think one of the targets has to also be the middle people in this whole scheme, especially the PBMs, because if you, and there are some bills that go after that and say that if there are rebates that companies are getting in terms of how they make profits off these drugs, that they have to share that with the consumer. Again, this all goes back to the consumer. So, rebates are something that I think is generally not understood by the public in terms of how this financial system works. But you have the manufacturer that manufactures the drugs, and then you have rebates that are taking place in terms of how people are distributing and delivering that to the middle people. So, in terms of you asked about whether we could source the materials, I don't know that. That's beyond my pay grade. So. Maybe Representative Syed could address that.
I'm not too sure about the sourcing of the materials either, but when tying it back to the Prescription Drug Affordability Board, these upper payment limits should be simplifying the system, similar to how rates are set in other countries. And we see the way that manufacturers adjust to the different laws of different countries, from Canada to any other country besides the U.S. They are able to adjust to those markets and the rates and the regulations that are set there. And similarly, the Prescription Drug Affordability Board would function like that. And I just want to note that there's for PDABs in other states. I believe 8 other states have it. Virginia just passed out of their House and their Senate. Pennsylvania also introduced this legislation. So it's gaining momentum because folks are recognizing the need to set these upper payment limits. I hope that helps answer.
Yeah, no, I think it definitely does. And I know, Leader Kaler, you made reference to PBM, so I just want to share that acronym. That's Pharmacy Benefit Managers, in case anybody didn't know what that PBM stood for, and that's kind of that middle, well, a manager, if you will, that is, controlling a lot as it relates to price, and they certainly take their chunk of money. So PBMs, they're getting a lot of attention, more than they ever have, right? So that just wanted to clarify that as well. And then, okay, great. Thank you guys so much for those answers. I think that's really helpful, and hopefully, Mary, you feel it was helpful for you. And I will certainly bring back on the raw materials. I've actually never had anybody ask me that, and we've not, myself particularly, have not looked into that as much, and I certainly will. So thank you for bringing that to my attention specifically. Okay, so we have another live caller, so let's go to her. So Joyce from Mount Auburn. Joyce, are you there?
Yes.
Hi, thank you for being on the call, and please ask your question.
Yes, I have kind of a two-part question. One is I am a type 2 diabetic, and I have to take Januvia, and I was reading on the internet when it came time for renewal of my Medicare, that it was supposed to go generic, but the drug company somehow got it extended where it's not generic yet. And the other question is, I'm on Part D Medicare plan, and this year the Part D premium doubled, and I also take COPD medication, and my Trelegy, just to get the first filling for this year, will be $400 and some for 1 month. And I was wondering why Part D doubled their prices. So I don't know if you can answer that or not. I know that's federal, but hopefully. There is no generic COPD medications either, and I wonder why.
Well, that's a great point, Joyce.
Well,
thank you.
I think that what you've pointed out in your question is exactly why we're doing this legislation. And again, there's a lot of things that need to take place at the federal level, and they're not. I can't answer your question why it doubled. But again, what we're having to do in terms of state government is do what we can to try to correct the inadequacies of the federal government. So I'll just point out that exactly what you stated is the reason why we have to do this kind of legislation on a state-by-state basis.
Yes, and I believe, just to add on, the drug that you mentioned is also on the Medicare negotiation list, so that the price that is determined through that negotiation process at the federal level will for sure get a UPL under our bill, under the Prescription Drug Affordability Board bill, through this legislation. And then just addressing that Medicare Part D, there will be a Medicare Part D copay cap in effect in 2025 for $2,000 annually. So this is past part of the Inflation Reduction Act. So that might be some information that is helpful. In general, though, these Medicare negotiations are projected to lower Medicare premiums overall.
Yeah, thank you, Representative Syed, for that, because that's exactly what I was going to add, that the medication that you made reference to is on that short list of first drugs that will be going through negotiation. So hopefully that alone will certainly help your individual case. And I just want to make sure everybody heard this, because this is a really big deal, Representative Syed. I think you kind of just cut out just a smidge, at least from my end, so I just want to make sure everyone heard this, that in 2025 there is a cap. And that's that $2,000 out of pocket that she referenced. So I just want to make sure that people understood that's going to be a huge relief as well, that passed in Congress. So certainly the door is, I like to say in prescription drugs and the work that's happening, at least in Congress, like the door is cracked open. And so now even at the state level, we kind of need to swing it open, right, and get some more relief. It's kind of how I like to kind of picture it. So Thank you so much for the comments that you guys just provided. Appreciate that. So let's go to another live caller. We're getting closer to the end of the hour, but we still have time. So again, if you have any questions or comments, please press *3 on your telephone keypad, and we'll get connected. And then let's go to Mr. Brown. Mr. Brown, are you there?
Yes.
Thank you for being on the call. Please ask your question.
This new drug they got out last year for SIBA for kidneys and heart, it's very expensive. It's like $1,800 for a 90-day supply. Are they going to have a generic or lower the price?
I'm not too sure about that drug. I'll have to look into. Do you mind passing that information along to AARP so we could take a look into that one? I'm not sure if there's how long that patent is lasting. When a generic option might be available.
Yep, I'll make sure that we get his information or we have a conversation for sure. Feel free, Mr. Brown, to contact AARP, and we will get connected and get more information for you. Yeah, great. Thank you so much. Okay, so, we've been obviously talking, I mean, based on what I have heard too, there is, a lot of need for a prescription drug affordability board, even more so after this call, frankly, if you ask me. There are so many folks that are spending a tremendous amount of money on prescription drugs. And so I guess I'm just I'm going to throw out a question here. Just, given what you've heard today, like, why is the prescription drug affordability legislation so important and really necessary now, regardless of what's happening in Congress? Just wanted your thoughts based on what you've heard so far.
I could start off. I think. All right, go ahead, Senator.
No, you go ahead.
I think all the input, all the questions that folks had, the specific examples of which drugs are, hurting our bond dollar, which ones are making it difficult for us to go to the pharmacy and pay for that over the counter, which ones are affecting whether or not people decide if they're going to pay rent that month or if they're going to afford their prescription drug. These conversations, these questions all highlight the need for some kind of oversight over an entire process that is, as we said before, it's a patchwork. It's not a good process. And I'll go as far as to say I don't think it's a good process by any means. I don't think it's too complicated for folks to understand. There's too many hands in the process between the drug being created at the manufacturer, the research and development happening there, and then all the way to us going to the counter to get that prescription drug. So this board is following the movement of many other states who have recognized that there is a need to provide some kind of review of this process of how much patients are actually able to afford the drug, the patient accessibility programs that are out there, how much is ending up costing them at the counter, to determine whether or not we need to intervene and we need to set a upper payment limit so that costs to the entire healthcare system are reduced. So I just want to take the time to say thank you to everyone that joined and everyone that shared these experiences, because it highlights that no matter what we're hearing about these drugs being accessible, that in some cases, and that may be very valid in some cases, but in many cases it's not. And we need to do whatever we can at the state level, at the federal level to address this. And I do believe that the Prescription Drug Affordability Board is a big step in the right direction to finally provide this oversight that is much needed over an industry that has remained unchecked.
Thank you so much, Representative. I wholeheartedly agree with you. Thank you. Leader Kaler, did you want to add anything?
Yeah, the representative stated it very well. I just wanted to go back to a point she made about everybody taking a piece of the profit as the drug goes from the research and development to the manufacturer to the end consumer, and that's part of the problem. I mean, if you I listened to all the different drugs that people have talked about on this call here. These are life-saving drugs. These are things that people need, and so we want research and development by pharmaceutical companies to be able to give us the best so that we can avoid, say, long hospital stays or avoid unnecessary surgeries, be able to, prolong our quality of life. I mean, that's what we all desire. But when you see all the money that's taken out of that system along the way from the manufacturers to the end patient, then you have to begin to wonder why. This is kind of a gravy train, and people companies along the way are making big profits that have nothing to do with really the manufacturing or the research and development. They are somehow, the middle people that are taking it from point A to point B. But it's very frustrating to see that the very things that are helping us to prolong and save our lives are the things that we just can't afford, and we have to make decisions about whether we pay rent or whether we buy groceries or whether we get our pharmaceutical needs met. And that's what's frustrating. This is the wealthiest nation in the world. We've got the best of the best here. Why can't we make this work for common, ordinary people? And that's really the challenge we have. And I think this kind of legislation is going to help us move the needle on this issue.
Agree, Leader Kaler. Thank you so much. Okay, so we have a question from Decatur. So Janice from Decatur, are you there?
Yes, ma'am. Thank you.
Thank you so very much. Please ask your question.
Well, one, I want to mention that the lady called and said that her medicine got more expensive, and I do know that there is, if the manufacturers can just put something new, a new ingredient, whether it's for the medicine or not, but if they can put something new in it, they can get an extension on their patent, and the price with that can also go up. The second thing is the medicines, every state, as you said, needs to improve, but it is a federal problem. Because with 50 states, or every state having a different one, you've got another mash of complex. And as the lady said, we have to simplify, and it's not being done at all at our level. I wondered why, when the military was able to get the pharmacies to negotiate with them, when the Obamacare began, why we couldn't have the same obligation. But that's how the pharmacies went ahead and got on the same deal. So I understand the complications, but state and federal both makes it so much more complicated. And is there any way they can simplify and make it one way? I had a friend that I had to take her home. She was having problems. I said, go to the doctor. She was one of the low income, but she had a $6,000 deductible. And she said, Janice, I can't go to a doctor. And by the time she did, she was dying. That we need to simplify and let the doctors be doctors and get the bureaucrats out of medicine. Thank you.
Thank you. Thanks, Janice. Any response to Janice?
Well, she's very perceptive, and she's right on target with that. This bill will not solve all of the healthcare problems across the country that we have, and pharmaceuticals is just part of our healthcare issue. We also have the rest of the medical system as well. But it's unfortunate that each state has to kind of go it on their own. But that's kind of where we are, and if we have that, that's what we have to do. But let's all keep working on having a more simplified and more effective system for all of us federally. That's really the ultimate goal.
Right. Agree. Thank you so very much. So we're coming to the very end of our call here, and so I just want to give you both 30 seconds. Any final words, comments, and Leader Kaler, we'll start with you.
Well, again, thank you for doing this. And again, AARP has always been in the forefront of representing the interests of older Americans. So I commend you for that. I want to thank Representative Said for her partnership in this. I learned a lot from her. I've learned a lot from her even this morning. And I think that, we're going to be successful in this. And all the reasons that people have stated through their questions and through their comments are the very reasons that we're doing this. And so I'm just happy to be a part of this, and thank you for all participating.
Thank you, Leader Kaler. Representative Syed, any final comments?
Just want to reiterate, thank you so much. Thank you to Senator Kaler. I'm excited to work with you on this, continue the work on this. Thank you so much to AARP for facilitating this. And this was so helpful in just our understanding and my understanding of when I go talk to my colleagues, what to share. These are real stories. People are experiencing them. And it's clear that people are not alone in this and facing these accessibility and affordability challenges. I would encourage you to share these stories with your elected officials, with your representatives at the state level, especially given that, we're working on this bill. We want to get it passed this session, and also at the federal level, so they understand that this is a top priority for people in their districts. We were elected to represent our communities, so it's important that as elected officials, we hear from our constituents. So I would encourage you to please, call your representatives, reach out to them. And once again, thank you so much for sharing your experiences, for sharing your thoughts. This was very helpful to me as well.
Thank you so very much. So as we conclude today's telephone town hall, I'd like to express really my sincere gratitude to our distinguished guests. So Assistant Leader State Senator David Kaler and State Representative Nabila Syed for their commitment to enhancing affordability and accessibility of prescription drugs. Appreciate you, and AARP absolutely looks forward to working with you, not only on the Prescription Drug Affordability Board, but also all the other prescription drug affordability measures that we probably have to work on in the future. So look forward to our work together. Now, to all of you who have joined us today, your engagement and support really does help make AARP Illinois Victories of the State House possible. So this is why we are inviting you to be a part of our campaign to ensure prescription drugs are both affordable and within reach. So after our teletown hall, please stay on the line, if you will, to be directly connected with your state representative. So you don't even have to look it up. You can stay on, and it will ask you your zip code, and you will get connected directly to your state representative. Your voice is crucial in encouraging them to support and potentially sponsor, dare I say. But yes, support and sponsor the Prescription Drug Affordability Board. The legislation, we didn't say a House number, but the House bill is 4472. So again, the Prescription Drug Affordability Board is House Bill 4472 in the General Assembly right now. So when you get connected to your state representative, please share with them to support House Bill 4472. I want to thank everyone for participating today. If you need more information, we had a couple callers ask for how do I find out more about other events. You can go to aarp.org/IL. That's our website. You can certainly find out specifics on the Prescription Drug Affordability Board, PDAB, on that website. So please go to it if you have additional questions, and feel free to reach out to AARP in that way. Thank you for participating in today's live teletown hall. Again, please stay on the line and be connected to your state rep. Ask them to support House Bill 4472. Thank you so much. Have a wonderful day, and this concludes our call. Thank you so much. Bye now.